Hi, my name is Robertson, and today I'm going to be doing a head-to-toe assessment. I'm going to begin by washing my hands. Good evening, Mr. Yeedy. My name is Lauren Robertson, and I'm going to be your nurse today. Today I'm going to do a head-to-toe assessment. Can I verify your name and date of birth?
Yeah, Alfonso Yeedy, August 9, 1979.
Thank you very much.
You're welcome.
I'm going to verify that with my records. All right, now I'm going to assess two facial symmetry landmarks, the palpebral fissures and the nasolabial folds. The palpebral fissures, I'm going to ask you to close your eyes and open. And the nasolabial folds, I'm going to ask you to smile. These are the nasolabial folds, please. Thank you. Now I'm going to palpate the head and scalp, noting for any bumps or masses. Everything seems normal. I'm also going to inspect the skin of the scalp and note that it is lighter than the color of the skin on the face. I'm going to palpate the temporal arteries, noting a depression. Now I'm going to assess the patient's temporal mandibular joints. I'm going to ask you to open and close your mouth. Okay, thank you. Now I'm going to assess cranial nerve 5. Can I have you clench your teeth with your mouth closed? Okay. Now I'm going to ask you to smile, puff your cheeks. Okay. Squeeze your eyes tightly. Wrinkle your forehead. This is an assessment for cranial nerve 7. Now I'm going to test extraocular eye movements. Cranial nerves 3, 4, and 6. Mr. Didi, can you follow my pen?
Yeah.
Without moving your head? Okay. Now I'm going to assess visual fields by confrontation. I'm going to have the patient cover your right eye with your right hand and tell me when you see the object appear.
No.
Okay, now I'm going to ask you to do the same with your left eye over your left hand over your left eye, and I'm going to do that again.
No.
Thank you. Now I'm going to assess for pupillary response, and I'm going to do this by dimming the lights. Okay. Now I'm going to perform an external ear inspection, noting that the ear structure is intact. There's no buildup of wax. I'm going to palpate the ear, noting that the cartilage is also intact. Now I'm going to perform a nasal inspection, noting that the patient does not have a deviated septum and the nares are intact. Now I'm going to test for nasal patency. I'm going to do this by squeezing the patient's nostril on one side and asking the patient to blow out through the other. Now I notice that the patient has difficulties in the nasal patency on the right nare, so I'm going to document this finding. For the mouth, I'm going to inspect the lips. Can you stick your tongue out and up? Okay. Teeth and gums, noting that the gums are pink. I'm going to inspect the posterior pharynx. Can you open your mouth?
Yeah.
Okay. Now I'm going to ask you to stick your tongue out and say ah. I notice that the uvula is intact. Now I'm going to inspect the tongue movement by asking you to stick your tongue out and push each cheek inside with your mouth closed with your tongue. Perfect. Now I'm going to identify the landmarks for thyroid palpation. So right here, across the neck. I'm going to palpate the thyroid gland with a posterior approach. I do this by placing my hands behind the patient's neck. Can you lift your head a little bit and relax? I'm going to palpate the neck nodes, beginning with the occipital, the post-auricle, the pre-auricle, the parotid, the retropharyngeal, the submandibular, the submental, the anterior cervical, the posterior cervical, and the subclavicular. Palpate all the neck nodes. Now I'm going to palpate the carotid artery one at a time. I'm going to auscultate the carotid artery. When I place my stethoscope on the artery, I'm going to ask you to take a deep breath and hold it. Go ahead. Okay. We'll do it one more time. Okay. Now I'm going to do a heart examination. The heart examination, can you please face this way? The heart examination can be done in various positions. This patient is going to be assessed in the sitting position. However, it can be done in a standing position or in a supine position. I'm going to begin by palpating the radial artery. Then I'm going to do the dorsalis pedis. And the posterior tibialis. Now I'm going to auscultate the 5 areas of auscultating heart sounds. I'm going to do the aortic, pulmonic, Erb's point, tricuspid, and mitral. S1 and S2 can be best heard on the left side of the heart, and S3 and S4 can be best heard on the apex of the heart. I'm going to do a chest and lung assessment. I'm going to begin by percussing the posterior lung field. Other areas of the chest that can be percussed are between the 5th, 7th, and 9th intercostal space on the anterior side of the chest. Now I'm going to percuss the CVA. Okay, now I'm going to perform a test for tactile fremitus. When I place my hands on your back, I'm going to ask you to repeat the words 99.
99, 99, 99, 99, 99.
I'm going to do the same thing on your anterior chest.
99, 99, 99, 99, 99.
Thank you. I'm going to also take your posterior lung fields. Take a deep breath with your mouth open, please. Okay. And out. And out. And out. I'm going to auscultate the anterior lung fields. With your mouth open. And out. The lateral lung fields. I'm going to ask you to turn this way for your abdominal assessment. For this assessment, the patient was undressed, and I'm going to begin by inspecting the abdomen for any abnormalities. It is normal to see a rising and falling of the abdomen, and the abdomen should feel soft and non-distended. It is an abnormal finding to find a distended abdomen. I'm going to also take all 4 quadrants for vowel sounds. And I'm going to auscultate for vascular sounds. I'm going to perform a general percussion of the area. Noting that the patient's abdomen has a rebound, which is a normal finding. I'm going to assess for the liver border. I'm going to perform a palpation of all areas. Do you have any pain?
No.
Okay. Now I'm going to perform a deep palpation. Please verbalize if you feel any pain. Okay. I'm going to palpate the liver and the spleen. And the kidneys. And the aorta. Now I'm going to perform the neuro assessment. I'm going to assess for cranial nerve 11, and I'm going to ask you to turn your head against resistance. Okay? Same for the other side. Okay. Now I'm going to ask you to shrug your shoulders against the resistance. This is a test for cranial nerve 11 as well. Okay. Now I'm going to assess upper extremity fine motor coordination. Can you pat your knee with your palm, alternating palm, so right hand to left knee, and do that as fast as possible, and the same thing with your left hand to right knee, alternating.
Like that?
Yes. Now to the other one. Okay. I'm going to ask you to do the finger to thumb test in this manner. Okay. Now I'm going to ask you to touch my finger with your finger. Perfect. Now can you do the other one? Okay, thank you very much. Now I'm going to assess your lower extremities. I'm going to ask you to do a heel to shin test, in which you will extend one leg, and then you will touch the shin with your other leg. The heel?
Like that?
Yes. Right. Okay, now can you extend this leg? Extend it and do it with this leg. No. Extend this.
Like that?
No. Extend this leg. I'm going to ask you the heel of this leg, touch your shin with it. Touch this shin.
Like that?
Yes. And now do the opposite. Extend this leg with this heel. Okay, thank you. Now I'm going to assess the bicep reflex. Okay. Now I'm going to test the patellar reflex. Can you relax your legs? Put this leg, no, relax the legs. Put this leg over, no, this one over this one. Cross your legs. Perfect. Relax this leg. I'm going to assess for the patient's patella, which is right here. And then I'm going to perform the patellar reflex test. Okay? I'm going to assess for the Achilles reflex. Okay? Now I'm going to do the position sense of the great toes. And with a tuning fork, I would place the tuning fork on the tip of the patient's great toe to assess for the vibration sense. Okay. Now I'm going to ask you to stand up. Can you turn around and face me? Can you stand with your feet together, hands by your side in a relaxed position, and now close your eyes. Okay? Now I'm going to ask you to walk a few steps toward me with your eyes open. Can you walk a few steps toward me? And back. Okay? Now I'm going to ask you to walk with a heel to toe manner. Heel to toe. Okay? You can have a seat. Mr. Didi, thank you for your time. I have completed my head to toe assessment.
Thank you.
I'm going to finalize my assessment by washing my hands. After washing my hands, I will document all the patient findings. Thank you. My name is Lauren Alexandra Robertson, and I'm a student at FIU, and this is a head-to-toe assessment for my health assessment and promotion for nursing practice course. Thank you.